was diagnosed with cancer back in October. I had a slow-growing chondrosarcoma in my left hip, and had surgery in February that removed 2 of the muscles, the tumor that was the size of a softball, and part of my pelvic bone on the left side. So when that was done, got news from the doctors that it was all taken out, and then it was just getting back to the rehabilitation and getting mobile again. And with that said, the doctors had told me, crutches for 6 months, possibly a cane for the next year, possibly the rest of my life. So when it came time to get back in the game and get functional again, talked to the insurance company, found out, who was in group as far as getting physical training and getting back on my feet. And they gave me 3 locations out here in the West Valley, and Pablo is the closest one to me, about 5 minutes from my house. And I came in here first, looked at the facility, and went to the other 2, talked to people, looked at the facility, and after seeing the other facilities, I made my decision to come here. And then after my first visit with Pablo, I knew this was the right place for me. Within that 6-month period, actually it's been only 4 months, I don't even walk with a cane, crutches, nothing. So I'm a happy guy. I'm doing things they told me I wouldn't be doing in the next 2 years. So Pablo is the guy to keep me motivated, and he knows his stuff, and he got me back on my feet quick.
It is very critical to continue to communicate with patients, to be able to hear their signs and symptoms and understand what decisions clinically we need to make on a day-to-day, visit-by-visit, so that we know when to challenge them physically, when to respect the symptoms they're reporting, how to handle those symptoms. Do we then choose that particular day to not exercise train, but to treat more than exercise train? Do we do a 50-50 mix? Do they receive a partial training session with hands-on care? Or do they receive no hands-on care at all, and we just train because we have a green light that says no symptoms reporting, no signs of swelling or anything that would indicate an inflammatory response to the hard work that we're doing in getting them functionally ready to be able to return to work or return to the playing field or whatever the status may be.
I had a number 6 bone removed from my neck about 3 weeks after my treatment here. The pain stopped in the back of my neck. I was having a lot of pain in the back of my neck. With the massages and the exercises with my arms, it has really helped.
She had a cervical corpectomy. It's an interesting case. There's a lot of things that I had to talk to the doctor about and make sure that we were doing things that were appropriate with her care. And it's been a nice progression with her. When we started, there's been a big balanced progression to work on stabilization throughout the cervical and thoracic spine. She's progressed very nicely. Every time she comes in, there's just a little bit added. She has risen to the challenge very well.
So far I'm doing really great. They've really helped my neck. Now I can move from side to side, which I couldn't before. And every day I'm improving. I think the people here are really great, and they're really helping me.
I started with Pablo about 10-12 years ago when I first got injured in 1996. It was great. He got me up and going. I went back to work. I'm back 12 years later after a new surgery, and now I'm rehabbing it. He's getting me back to where I need to be, getting strong. Everything's good. I don't know what I would have done without him.
Anthony Mavoli is a very, very special circumstance. There's a gentleman who unfortunately has lost his job. There's a gentleman who's had multiple surgeries to his spine and has come here in search of restoring what he can from the shambles of his spine, if I can put that in those terms. And the reason I put it in those terms is because I honestly don't feel that hard manual labor is in his future. Now he's older and with a spine that's not as strong as it was once. Even though surgically speaking, he is very stable, he is upright and walking, and I know his surgeon, and I know that Anthony, as I am, are very proud of the progress he's made to date. But there still has to be a care and a concern and a very watchful eye, not only on Anthony's part, number one, but on all of our parts. There's a responsibility to teach him and train him and educate him and motivate him as to which direction he needs to go in, versus just giving him a carte blanche just because he's had a spinal surgery, this case multiple, and say, well, carte blanche, you can do whatever it is that you need to do and you like. I think that's unfortunate, and we hear those stories. I think we need to do the professional responsibility that we're asked to do in training and teaching, as I mentioned, and motivating and being a true support system for these folks that have gone through those kinds of detailed surgical rigors that they've gone through.
I knew as soon as I came out of this surgery that who I wanted to go to, and whatever it would take, I would have came here because of the fact he's got it. I mean, he knows how to get people going.